I feel very humbled and a little bit, this is crazy, what am I doing here? There's much more deserving people than me. But it's a good opportunity to talk about the work, acknowledging the work the carers do.
If we're going to support the next generation of nurses and ensure that they have a place, we have to make sure that their voices are being heard and that we're tapping into their expertise and what they can contribute strongly to promoting the health of our countries. To be an honorary fellow in the Royal College of Surgeons, it says that the things that I've spent so much of my time and energy on have made a difference. That's what I want to do. I want to make a difference in this world in my lifetime.
My father had a massive stroke in 2016. It's just like this person's life changes forever. And then from there, the roles change. You start becoming the carer. That's where it really started, was trying to figure out how my father's care would pan out. We made a documentary called We Need to Talk About Dad, and it was him allowing me access into a very personal period of his life to make a documentary which resonated wildly with people. I noticed that it was the great unspoken conversation, and particularly around family carers who were not being recognised.
When my father was dying, I took care of him for the last month that he was alive. And I saw what was important. And I had been an intensive care nurse. I thought I was a hotshot nurse. And when I took care of my father, I realized it really is some of the basic issues. We are there to care for people, to promote the health of individuals, families, communities, our world, and our planet. And I fear that we are so focused on the bottom line and so focused on high-tech care that we're losing sight of what really matters to people. It's listening to their concerns. It's making a difference with each individual, paying attention to the health of the community, listening to the community. What we do is very political. Politics is about the allocation of scarce resources. And so if we're going to be players on the stage of healthcare, we have to pay attention to our role and our responsibility in influencing that resource allocation. We have to not only listen to nurses, we need nurses at policy tables.
You know, even coming here today and finding out that the RCSI was the first medical college to acknowledge nursing as a science and as a discipline 50 years ago only, I think care is on its way to be acknowledged in the same way, definitely. It's so important. I'm really optimistic in a very selfish way that my generation who are now running the show, they're looking and going, Mike, I'm probably going to be here till I'm about 80 or 90. I'm going to have to put in, systems that work for me when I get there. So I do believe it's changing and evolving. With every step forward, there's half a step back. So you just have to constantly keep the conversation going. But I'm optimistic that it's changing and changing for the better.
I would love to leave a legacy for other nurses that we must be thoughtfully bold and to use your voice on behalf of the health of people of this nation, of this world, and of our planet.